Good morning, everyone. Today we would like to thank Dr. Sivaprakash, oral health care specialist and director of Smile Group, to join us and enlighten us on oral health. I'll try to be very general, doctor. I'll try to ask general questions so that our general audience should get awareness about oral health. So, according to you, what do you think oral hygiene is, or oral health is important for?
Let me start with a small introduction. I'm Dr. Sivaprakash. I'm the founder of Dr. Smile's group of dental centers. And in my experience, there are certain things I wanted to share with everyone.
Yes.
When it comes to oral hygiene is a crucial part of overall health of every individual. Normally, people neglect oral hygiene in the sense that they avoid brushing twice. They don't take the right food that will be helpful to maintain good oral hygiene, all that. But in turn, it affects the overall health as well. So it's important.
Okay. So, sir, according to you, how often a normal layman person should visit a dentist or get a dental checkup done?
Yeah, like coming to regular visits that a person should have, a minimum of 6 months to 1 year is the gap that you can have between visits. The idea behind visiting once in a year or within a 6 months of period, like the idea is, for example, if I have a dental problem in my upper teeth, I cannot help myself. As a dentist, if I cannot help myself, that is a question of a normal person, a lay person helping himself. So there is no way that the lay person can help himself. So the idea behind visiting a dentist is to make a friend, have a good friend, have a nearby dentist as your friend, and evaluate yourself. Have a regular checkup so that a small decay in its early stages, if it's attended, the tooth is as good as a original tooth. But when the decay is spread across and becomes bigger, you end up doing a root canal or you end up removing of a tooth. When you remove a tooth, the challenge we face is replacement is not as good as the original tooth. So whatever is given to you by God, try to protect it and preserve it throughout life.
Like naturally, we can preserve it, it's better.
Yeah, more you retain your natural teeth, it's good for you.
Sir, as it's Healthabove60, so how old age or aging can affect the oral health?
I will give you a clue. Like, aging has no connect to preserving of a tooth. If you can have the right habits, good food habits, and timely food habits, all that, then you can prolong the teeth throughout life. What I mean is, like, you can see some skeleton of somebody who had lived thousands of years back. You will see teeth in it, which means teeth is not restricted to a particular age. There is a myth that people say beyond 50 you cannot preserve your teeth, all that. It's more to do with your hygiene habits that you will be able to preserve your teeth and prolong the life of the teeth. So your teeth can be prolonged throughout life. It's more to do with your oral hygiene habits and food habits.
Okay. Sir, when we talk about dental health, it's people think that it's limited to those only 32 teeth.
Correct.
So how general health and dental health are connected?
Yeah, I connect it to a different situation. Like, as a person is suffering with, as they brush their teeth, they get bleeding in the gums, all that. Some people have that. So, majority of the people have the opinion living with bleeding in the gums is normal. That's one instance. That's some of the situations where you get infected gums, all that, where you have, when you brush, you get bleeding, all that. When the bleeding happens, it is contaminated with so much bacteria. You tend to ingest it whenever you eat your regular food. So bleeding gums or some dental decay, cavity, all these are normally infected situation which generates more bacteria that goes into your intestine. So when you ingest food, all that, it goes along with it. So it's not hygienic to maintain like when you have bleeding gums, all that. It has to be addressed on time. That's how we can protect your oral hygiene, which in turn will protect your overall health as well.
So as we spoke about bleeding gums,
Yeah.
So what all conditions we can have where gums, bleeding gums can be a symptom?
Correct. Bleeding gums is a sensitive thing that has to be addressed. Other than when you prick with the sharp instrument, you hurt your gums. Other than that, there are situations where dirt accumulation, we call it calculus or tartar. If you browse through the net for these words, tartar, T-A-R-T-A-R, or C-A-L, calculus, C-A-L-C-U-L-U-S, calculus, these words will make you understand dental calculus and dental tartar are so harmful for your teeth. It tends to reduce the level of the bone that is supporting the tooth. So this sort of infections or that tend to make your teeth loose in the long run. Maybe by 40 to 60, in that range you will tend to have shaking teeth, which is due to the gum infection that's happening inside below the teeth. So ideally, protecting your gums by undergoing a small procedure called dental scaling, which is done by a dentist, can prolong the life of your teeth, as well as you will have oral health good because the infection doesn't get ingested when you eat your food.
Okay. So, like there are so many toothpastes which are available. People tell there are advertisements and all. So, which toothpaste or what ingredient of toothpaste you think is important? Because people generally get confused with toothpaste. So, according to you, what is which toothpaste should be used?
This is a big challenge because there are so many advertisements that say I have added salt to your paste, I have added neem to your paste, neem leaves are inside it. It matters in no way, it doesn't have any connect to your oral hygiene. What is recommended is anyway all the paste that you use will have calcium carbonate as the major component. So using a toothpaste for a parameter, I could say use a paste that is white in color. That is a strict parameter. You can paste of white color is more than enough to like guide you to choose a paste. So paste, more than the paste, it's the question of how many times you brush every day. Twice brushing will mean a lot. We have seen people who brush the quite concretely different. Individuals who have very hygienic teeth. So distinct difference is that. So that's why we keep insisting that you should brush twice. Having seen people with hygienic oral hygiene, good oral hygiene when they brush twice, we specifically insist every patient to do this twice brushing and taking timely food. Why timely food? Timely food as well impacts your oral hygiene. Untimely food will tend to create acidity and wear away all the teeth in your mouth. So wearing will also be an impact due to untimely food.
Sir, there are myths about wearing a denture.
Okay.
Like when they tell old age people they wear a denture and they think their teeth will become loose, their teeth may fall. What's your say on that, sir?
Wearing a denture is crucial because whenever we go to sleep, there is a position we call it physiological rest position. Our upper teeth and the lower teeth should be 2 millimeters in gap. When you go to sleep, you should have a gap of 2 millimeters. We call that resting position. The jaw's resting position. When you lose your teeth, why we design dentures? It's because to restore that 2 mm resting position. If you don't have a parameter that design, like if you don't have a denture, your jaw tends to give a shaking feeling. Like some people tend to like push the tongue out. They keep doing that. If you have noticed that people who don't have a denture, they keep pushing the tongue out because they are trying to get their jaw into that resting position psychologically. The nerves tend to get to that particular resting position. So that resting position is very crucial in designing the nervous system in the face. So ideally a person has to wear a denture. If they are not comfortable wearing dentures, it's for a short while. Once you get a denture fixed, it takes around 10 to 15 days to get adjusted to it. Once it is like set and you are on the move, then you will not have any problem with any denture. And of late we have options for implant dentures where we can fix thin body compatible titanium pins that go into your bones and get stuck to it. It's body compatible, harmless, and we have proven records of 96% success rate. So we keep doing implants every now and then so that people are comfortable with fixed dentures. So dentures need not be removable of late. You can think of fixed versions as well. Like when you start wearing these dentures, you get the older pattern of resting position and your sleeping pattern, everything, and the nervous system, the head and neck region will be very comfortable as such. So ideally, wearing a denture, don't look at it as a challenge. Look at it as a discipline to give your face a very good resting position as you sleep.
Okay. Sir, when we came to dentures, other means are like braces.
Yeah.
So what according to you is the age of wearing the braces?
Yeah. For children, wearing braces in ideal situation, not every child needs to wear braces. Ideal situations, we choose and select certain situations where we'll have to give braces for the kids, and it is recommended by around 7 years of age you should visit a dentist so that dentist can evaluate if you need braces or not. There are some situations we can do small procedures, we call it serial extractions. We do that procedure to eliminate necessity for braces. If serial extraction done properly, it can even eliminate situation. It can help you to the extent of avoiding braces. But the age should be around 6 to 7 years of age. That's when we can think of braces that are interfering braces. But ideally, when there are situations that we choose where we start braces at 12 years of age. That's when you get all the fixed like permanent teeth in place. All the main teeth would have shed off, and you would have got all the permanent teeth in place. That's when we can think of braces. So ideally 12 years of age is when we consider giving you braces.
Okay. So sir, after braces, they call it as like to stabilize the alignment.
Yeah, there is one situation that you are right. Like post wearing braces, there is something called retainers. Why retainers? See, braces are used to give a particular pressure to position the teeth in a new location. But as the teeth are moved to a new location for convenience of biting, everything, so many factors are corrected through that. You have a joint here. When you open your mouth, you can feel it in this place. Before the ears, you can feel a joint here. So when you fix the braces and correct all that, these joints are so comfortable, you will not hear any clicking. There will be clicking in patients who don't wear braces. All these can be corrected in the long run. But after changing the position of the teeth, there will be a tendency for the teeth to come back to the old position. We call that relapsing to the old position. But to avoid that, we give something called retainers. It requires a lot of discipline, like because when you give retainers, it is for retaining as the word mentions, it's called retainer, and it retains the teeth in the new position. So the new position should be held back, and it should be worn for at least 1.5 years with gradual reduction in time. First 6 months you wear it round the clock, then the second 6 months you can reduce it by few morning sessions alone. Then you can reduce it to few days in a week. That a dentist will be able to guide you. But when you wear retainers, it is a question of your discipline that you can retain it well, and the benefit of wearing the braces would be conveyed to the retainers, and it will help you in the long run.
So sir, as you said about retainers, what are the different type of retainers which are available?
Yeah, we choose retainers based on the ideal situation. There are certain retainers that we can fix to your jaw itself. There are certain retainers you will have to remove and wear it. But that's why I insisted when wearing retainers, there is a high degree of discipline that is required. Because when you wear the braces, you cannot remove it, it's fixed. But when after finishing braces, when you come to retainer stage, I have seen a lot of people, like majority are very cooperative. Very few people, they don't cooperate by not wearing it in the stipulated time, scheduled time. So when they skip that, there is a chance that it can relapse. The teeth can come to the old position. So ideally, wearing retainers promptly will mean a lot.
Sir, can you create awareness little about the brushing technique?
Yeah.
Like how brushing technique can help our audience?
Ideally, use a medium hardness brush. There are hard brush, medium and soft brushes available in the market. Go for the medium brush. And using the brush, the upper teeth should be brushed up downwards, lower teeth down upwards. That's the pattern you can use. Normally people tend to do a horizontal brushing pattern. That's not ideal. Upper teeth should be brushed downwards, lower teeth should be brushed upwards. That's how we can do a proper technique that can completely eliminate the food that is stuck between teeth. And when you go to the inner aspect, you can brush as usual. That you won't normally do a mistake. But only in the front side, normally people tend to do a horizontal brushing pattern. Instead, brushing downwards will help you a lot. Lower teeth down upwards will help you a lot.
Okay. Sir, our geriatric health population, how they can take care of their dental health or oral health? Some facts about that.
See, with age, it's not necessary we lose all the teeth. So, as I said, I can share some tips that can have your teeth, that can help you to have your teeth throughout life. Brushing twice, as I said priorly. Take timely food. Timely food will, I have seen people who don't take timely food get severe impact on the teeth. So, timely food. Increase your water intake a little. Increase your water intake a little. And the fourth point I would suggest is bite hard foodstuffs. I have seen vegetarians getting impacted due to develop lot of calculus and tartar, dirt accumulation on the teeth. Vegetarians, because of the food habit being very soft. Of late, people have skipped the old traditional way of having food. So it's not that you have to become a non-vegetarian. That you can choose food that are hard enough to keep your teeth very impactful. You can choose raw guava. You can have peanut. All these things that will biting sugar cane. All these sort of habits that can impact your teeth and give a very good suspension-like effect on the tooth. When you eat hard foodstuffs at least twice a week, you tend to prolong the life of the teeth. For geriatric, I am very sure there are people who would have lost some of your teeth. With age, you would have lost some teeth. I would recommend it to be replaced because I was telling you about 2 mm resting position, which is lost when you lose some of your teeth. That resting position is crucial to retain the nervous system intact in the face and the head and the neck region. So, when you even if 1 or 2 teeth are lost, you tend to start biting in the other side where you have more teeth. So, ideally, when you lose too many teeth or if you have very few teeth missing, that has to be replaced so that you retain the intactness of the nervous system.
Sir, one more question which came from our audience was regarding teeth whitening.
Oh.
People generally go for teeth whitening for some occasions or when they feel. So what, according to you, when they should go for this teeth whitening?
Yeah, teeth whitening is a cosmetic procedure that we accomplish to give a brighter teeth for you. But it is a harmless procedure. You can do it before some functions as a cosmetic procedure. And once you do it, we can reverse the yellowness of the teeth and towards whiter look by 2 to 3 shades. We can make it whiter by 3 or 4, 2 to 3 shades so that it looks brighter as you smile. And teeth, as it becomes white using this teeth whitening method, it is very safe, nothing to worry.
Okay. Sir, one more question which has arisen is many of the cardiac patients are recommended for dental health checkup before any treatment. Why is that so?
Okay. This is an interesting question from your audience. I see people who are reporting for cataract surgery, cardiac surgery, or any other surgery, even before any kidney related procedures. What is recommended is hygienic mouth. There should not be any infection in the mouth. Gum infection or dental cavities can generate bacteria that can go into the blood and disturb the success of the surgery. We call that infective endocarditis. In case of cardiac surgery, there is something called infective endocarditis. A small infection in the mouth can spread to the blood and create something called focal sepsis. The word focal sepsis is the right word that can make you understand the mechanism. The infection is somewhere, but it spreads through our body and spreads to the spot of surgery and disturbs the success rate of the surgery. So ideally, any cataract or any other procedure involving surgery. Ideally, you should take a proper measure of proactively removing all the infection in the mouth. Meeting a dentist before surgery is very, very crucial. So it can help you in the success of, it can facilitate the success of your surgical procedure.
Okay. Sir, there is another query which tells that how does artificial teeth set help the elderly people or our aging people? So how can it?
This was addressed earlier as well. See, artificial teeth not only helps you to speak, pronounce words conveniently, and it also helps in biting of food, chewing the food properly so that it gets digested better. Other than that, when there is some teeth lost, we lose that 2 mm resting position I was mentioning priorly. You can rewind and have a look on this point. The 2 mm resting position between upper teeth and the lower teeth is very, very crucial. So when a person is sleepy, that upper teeth and lower teeth have 2 mm gap. This is something we know as parameter based on which we design dentures. Whenever we put artificial teeth in place, we calculate that 2 mm and then design your denture. So all this scientific replacement of teeth has a science behind it. Whenever you replace teeth, we protect certain other factors like your jaw quality. There is a joint here, the quality of the joint is not disturbed. The pain, you tend to develop pain if you don't have a few teeth, because you start chewing in the side where you have too many teeth. So you tend to weaken this joint. Before you realize, you can put your index finger and feel it. There is a joint here that tends to wear. If there are too many teeth in your left side, you start wearing this joint. When you have no teeth at all, you tend to strain both the joints. So that sort of situations can be avoided if we can address it, replacing the dentures on time. Yeah, in initial stages. Even when you lose one tooth, it has to be replaced.
Okay. This brings us to the end of fruitful discussion which we had. So, doctor, I would ask you to end with a brief awareness or a talk about our dental health on this session.
Okay. See, we have almost covered many points concerned, which will be a concern for senior citizens as well as children at different ages. We have family members at different ages. My point is take timely food. Why timely food? It impacts the teeth. And my botheration is, even if you lose all the teeth, I can think of replacing the teeth. But the challenge is the parallel loss of bone, quality of your bone also happens when you don't take timely food. So that will have an impact on your bone as well, which cannot be restored that easily. So ideally, taking timely food will help you in the long run. Brushing twice, as I insisted, is very crucial, because brushing twice will give you a different quality of life. You will appreciate it if you keep doing it over a period of 3-4 months. Then you will not be able to sleep without brushing twice. That sort of care that if you can take, it will add value to you. I would like to end the discussion with advanced wishes for a happy New Year and a happy Christmas. Season's greetings to all of you, and have a great time this year, New Year.
Thank you so much.
Thank you. Thanks a lot.